Hi, doctors. Welcome to today's sessions. Today's topic we are going to discuss about lactation period, postpartum period, and its complications. So now remember this phase, the postpartum period. It is not just a recovery for mother; it is also the beginning of a completely new physiological state called lactation. The body has gone through major changes during pregnancy and delivery. Now it needs to restore itself back to the pre pregnant state that is called as puerperium. Puerperium. During this time, both physical and emotional adjustments can happen. So, our job as a clinicians is to understand these changes and recognize what is normal and what could be the complications. So, proper care and monitoring during this phase are very essentials to prevent any such of complications. Moving on to the phases of postpartum period. We divide this postpartum or a puerperal period into three phases: immediate, early, and late. Immediate postpartum is the first 24 hours after delivery where the risk of bleeding and shock is highest. Early postpartum is the first week where the involution of the uterus and establishment of lactation occur. Third is the late postpartum, which extends up to 6 weeks after delivery, where the body gradually returns to the normal stage. So, in this phase, we focus on the uterine involution, lochia, hormonal shifts or hormonal changes, and emotional well being. So, by the end of 6 weeks, the uterus almost returns to its non pregnant size, and the woman is usually physically stable unless there are any complications. So, this is the three phases of postpartum period. Next is the physiological changes in postpartum. So, let's see what happens physiologically after childbirth. As we have discussed, uterine involution, that is, after delivery the uterus weighs about 1 kg and gradually shrinks to about 50 to 100 grams within the 6 weeks. Second is lochia. This is the vaginal discharge after the childbirth. It changes color as healing progresses. Lochia red or rubra, we'll tell red first few days. Then Lochia serosa, that is brownish to pink in color around a week. And Lochia alba, that is whitish up to 4 to 6 weeks. So this is the different type of vaginal discharge we'll see in the Lochia. And cervix regains tone in a week. Vagina and pelvic floor gradually regain the strength. So this is the next physiological change. Next, the ovarian function, which remains suppressed in lactating women because prolactin inhibits the ovulation. Cardiovascular and urinary system slowly return to normal in 2 to 3 weeks. So, every system after the delivery is resetting. That's why close follow up in this period is very essential. So, that is the physiological changes we see in the postpartum period of the women. Now, coming to the lactation, how does milk production start? Immediately after the birth, when the placenta is expelled, estrogen and progesterone levels fall sharply. So, this sudden drops allows the prolactin secreted from the anterior pituitary gland to take over. Prolactin stimulates the milk production. Oxytocin from the posterior pituitary gland causes the letdown reflex, which helps the milk flow through the ducts. Frequent suckling keeps the prolactin high. And emotional bonding between the mother and baby actually enhances the oxytocin secretion. So, the physiology of lactation is beautifully balanced by the hormonal, physical, and emotional factors. So, that is the physiology of how the lactation is produced and what are the things we'll be seeing in the lactation process. So, this is what about the lactation physiology. Now we'll discuss about the composition of the breast milk. Composition of breast milk. breast milk is just like we can say it as a nature's perfect food. So it has three main stages. First thing, colostrum, the first milk, which is thick, yellowish, rich in proteins, vitamin A, and most importantly, IgA antibodies that protect the baby's gut. That is the colostrum. Next, transitional milk, that is produced after a few days, that is intermediate composition, like between the colostrum and the mature milk. Next is the mature milk. Mature milk is rich in fat, watery, lactose, contains lactose and all the nutrients needed for the baby's growth. And remember, colostrum should never be discarded. It is the baby's first vaccine. So provide ideal nutrition immunity to newborn. So in ask the so in nowadays many there are many myths that follows in our olden days and all. The colostrum is not a good thing. They have to no you have to put it out. It should not be given to the baby, so that is not the good thing. So everyone mm, have that kind of thought. So you have to always advise the patient after the delivery about the educate and counsel the patient regarding the colostrum thing. That is very important, because still that happens, because many of our ancestrals, they have that myth that colostrum is not a good thing to be given to a baby as the first thing. So they have to put it out, and you can the mother have to give the next milk. So that is not a good thing. So you have to educate and counsel the patient regarding this after the delivery. So that is about the composition of the breast milk. Next is the advantages of breastfeeding for the baby. So, what are the advantages of breastfeeding for the baby? So, what things will be given will the baby get from the breastfeeding? Breast milk provides the complete, easily digestible nutrition to the baby, antibodies and immune protection, protection against diarrhea, respiratory infections, and even chronic diseases like obesity and diabetes. Stronger emotional bonding and security also. So these are the things very important, and these are the advantages the baby will get from the breastfeeding. So breastfeeding is not just of such like normal feeding. It is a protection, connection and development all in one. So that is the importance. So we are discussing it now because these are the things you should be keep in mind, and always have to advise the patient after the delivery, not only to the mother, family, as well as the partner too. So this should be discussed after the delivery sessions. And also there are few advantages of breastfeeding for the mother too. So for the mother, breastfeeding offers many physiological and psychological benefits. It promotes uterine involution through the oxytocin release, reduce the postpartum bleeding, helps in weight reduction by burning extra calories, provides natural contraception through the lactational amenorrhea, though not a 100% reliable, but yeah, and reduces the risk of breast and ovarian cancers. So these are one of the most important advantages the mother get after like when while doing the breastfeeding. So we have to always encourage exclusive breastfeeding for the first 6 months compulsory. Okay, so that is the advantages of breastfeeding for mother. Next comes the postpartum complications. The postpartum period can have both physical and psychological complications. Some may appear early and others later. So, early recognition is crucial because many of these conditions, like hemorrhage or sepsis, can be life threatening. So, if not managed properly. So, we can divide them broadly into two categories, like physical complication as well as the psychological complications. Talking about the physical complications. So, the main physical complications are postpartum hemorrhage, puerperal sepsis, thrombophlebitis, mastitis or breast abscess, urinary incontinence, perineal wound infection, or pain. So, these are the main important physical complications a mother faces after the delivery. Most of these are preventable with proper aseptic care, nutrition, and monitoring, but we must always be alert to spot them early. So that's it, the physical. And moving on to the psychological complications, psychological problems are often overlooked. We have postpartum blues, that is transient mood swings, crying, emotional liability. It is common in first week, so it resolves by itself. Second is postpartum depression. More serious, persistent sadness, fatigue, poor bonding with the baby, needs counseling and sometimes medications too. Next comes the postpartum psychosis, a psychiatric emergency. Patient may have hallucinations, suicidal thoughts, or harm the baby, so it requires hospitalization. So, doctors, one thing important, always ask the mother how she feels emotionally, not just physically. And while doing this counseling and follow up, when you follow up after the delivery and all, you should be well knowledgeable to educate not only the mother as well as her mother's the partner, and also the family members regarding the physiological, psychological and physical complications a mother faces after pregnancy. That is very very important. You should be aware of all these things and you should be able to counsel, educate these to them, so that they have a good experience in the postpartum period. So that's it about the psychological complications. Moving on to the postpartum hemorrhage. So postpartum hemorrhage is one of the most feared complications. It is a blood loss more than 500 ml after vaginal delivery or more than 1000 ml after cesarean section. The causes can be remembered by the 4 T's. Tone, that is uterine atony, most common. Tissue, retained products of the conception. Trauma, lacerations of cervix, vagina, perineum. Thrombin, coagulation disorders. So that's it, the causes of postpartum hemorrhage. Management, massage the uterus, administer uterotonics like oxytocin, misoprostol, ergometrin and all. Control bleeding surgically if required and replace the fluids and blood promptly. So always anticipate and prevent PPH. Active management of the third stage of labor saves the life. So keep in mind that. That's about the PPH. And next is the mastitis and breast abscess. Mastitis usually occurs in breastfeeding women due to Staphylococcus aureus infection, often from the crackled nipples. Symptoms will be painful, swollen breast, redness will be present, fever along with tenderness. Encourage the mother to continue breastfeeding or express milk because milk stasis worsen the infection. So treat with antibiotics, warm compresses and proper breast hygiene. If it progresses to an abscess, incision and drainage can be advised or may be required. And remember, reassure the mother, most cases resolve well. So that is what about the mastitis and breast abscess. Next is the puerperal sepsis. So puerperal sepsis, this is an infection of the genital tract within 6 weeks after delivery. Common organisms are streptococcus, staphylococcus, E. coli, bacteria. Symptoms: fever, foul smelling lochia, abdominal pain and malaise. How you can prevent this? Aseptic delivery practices, proper hygiene, avoid prolonged labor or multiple vaginal examinations that you can do, and how that is these things can do to prevent the condition, and how to manage this: broad spectrum IV antibiotics covering the gram positive, gram negative anaerobes. IV fluids can be given, supportive care. Early recognition and treatment are very important in such cases. So that is the thing about puerperal sepsis. And next is the psychiatric disorders in postpartum. Here we'll differentiate quickly. Postpartum blues, which is very common and mild, it resolves its own. Postpartum depression needs attention, may require counseling and antidepressants. Postpartum psychosis, medical emergency which needs hospitalization and psychiatric evaluation. So these are the things you have to differentiate, because everyone says will be postpartum depression all, but there are differentiate between, there are difference between the blues, depression, psychosis. You should be always able to differentiate all these postpartum psychiatric disorders. Never ignore behavior or mood changes in the new mother. Early referral is the vital key here. Okay, so next is the OPD management, general postpartum care. So you have to advise them for routine postnatal visit. So focus on checking uterine involution and lochia pattern, examining the perineal wound, assessing breastfeeding technique, and addressing the nipple soreness. Advise diet, rest, and hygiene, and also screen for mood disorders and all. Minor issues like constipation or perineal pain can be managed with the diet, hydration, local care. So, and always educate the mother and give reassurance and counseling, which is very important, like the treatment too. So, that is how you have to manage an OPD basis. Moving on to the IPD management, that is in cases of complicated things. Admit the patients with severe bleeding, that is PPH, where if there is purpural sepsis or if there is a psychiatric emergency. In these conditions, advise the patient get admitted for the treatment. In hospital, what you can do, manage PPH with IV fluids, uterotonics, and blood transfusion and all. Manage sepsis with IV antibiotics and close monitoring. And for psychosis, ensure the patient safety and start appropriate psychiatric treatment. And always continually monitor the vitals and urine output. That is very crucial. Continuous monitoring and of vitals, urine output, and as well as the mental status. So these are the things which is very important when you're treating the patient after postpartum in the IPD level of treatment, giving IPD level of treatment. So that's about the OPD and IPD management of this postpartum thing, and how we can do the prevention. So what are the prevention strategies here? Prevention always begins during the antenatal period. Educate about the breastfeeding and personal hygiene. Active management of third stage of labor to prevent postpartum hemorrhage. Encourage early ambulation to prevent any kind of thrombosis. Promote good nutrition and mental support to the mother. And as I have mentioned in the previous slides, provide family education. Only educating and counseling to the mother is not sufficient. You should always provide a family education counseling and as well as a partner education counseling, because support at home is the very important key for the recovery from the postpartum. So that is the how you can do the prevention of such postpartum things, disorders, psychotic disorders and all. So that is how you can prevent it. And coming to the summary of today's session, to summarize this today what we have learned, the postpartum period involves recovery and lactation. Breastfeeding benefits both the mother and as well as the baby. Common complications like postpartum hemorrhage, sepsis, mastitis, and psychiatric disorders are present. Early detection, prompt management, and continuous support ensure a safe recovery of the mother. As a doctor and as a gynecologist and as a clinicians, our role doesn't end at a delivery. It continues through the postpartum care. So always have ask them or educate the patient to have a regular follow-up and postnatal follow-ups and postnatal visit to us, so that you can educate and evaluate their condition and how their mood disorders and how their mental status and physical well-being and all, so you can know about during the postnatal visit. So always advise them to come for a regular follow-ups and checkups. So that's it about today's session. I hope you had an idea regarding the lactation period, breastfeeding importance, and the postpartum period, what and all the mother faces and all. So that's it of today's session. Thank you so much for the patients listening. Hope you understood about today's topic. Thank you so much and have a nice day.